Good morning. It's a pleasure to be here. One of the problems with being the fourth speaker is that you can think about all those things you wish you had thought to say when you were writing your notes previously. So, I would have changed my presentation after each one of the speakers, but I'm going to just go with what I've got here. My office in the Department of Health and Human Services conducts social science research, develops policy, and evaluates program initiatives for children, families, and individuals. In some ways, we are also a translational research office because we have the dual function of increasing knowledge and then acting on those research findings through the development of policy. We don't usually develop programs, but we do work on the development of policy, that is legislation, regulation, and program models. Much of the research we do would be considered applied research or research synthesis. We evaluate programs or particular models within programs, and we look at the research findings across a number of disciplines to see if there is emerging consensus about relationships that might be amenable to policy interventions. We also fund a number of social science research centers that do basic social science research in the area of poverty and family functioning. We have a National Poverty Research Center, 3 area poverty centers, and we fund a National Center for Family and Marriage Research. These centers fund a significant amount of work on the causes and consequences of poverty and the dynamics of family relationships. And as you can imagine, they are very multidisciplinary, looking at economics, psychology, sociology, the whole range of disciplines, and how the activities of families and the activities of society involve poverty and both positive and disrupted family relationships. But one of the interesting things in being asked to speak today is that for the past number of years, our centers have been looking specifically at how poverty and family relationships affect crime and incarceration and are affected by crime and incarceration. And that has become part of the ongoing portfolios of work of those centers. For example, the National Center on Family and Marriage Research has funded and published papers on the relationship of incarceration to men having children with multiple partners, of adolescent drug use and sons delinquency. And it currently has funded 3 studies on fatherhood and incarceration, which will be part of a national fatherhood research conference that the center will be sponsoring in 2012. The 4 poverty centers have an extensive set of papers on the relationship between poverty and incarceration or crime. They focus on health, on welfare policy, on race, on aspects of employment, transitions into adulthood, child support, and have most recently funded a study on the relationship between incarceration and children's food security. And I would venture to guess that most of the folks in this room have never been to the websites of any of those centers to look at what they are, the kind of research that they're producing that directly affects the work that you do. But for us, the issue is not how to think about incarceration and crime as part of the context in which poverty and family relationships are studied, but how to translate the findings into something that is useful and operationally accessible to policymakers and program operators in both the criminal justice field and in health and human services. And I just want to give an example of one of the projects that we've undertaken in that arena. So about 5 years ago, Congress appropriated $150 million to fund responsible fatherhood and healthy marriage programs. It was the first such funding that had happened. We were sort of fresh off of a research conference that had happened a couple of years earlier. We had funded the Urban Institute under the leadership of Jeremy Travis, who some of you may know, to hold a conference on the relationship of incarceration to children, families, and communities. And from the findings of that conference, which gathered researchers from all kinds of discipline, we knew, or thought we knew, as is in the case with research, a number of things. One, that incarceration disrupts family relationships, that positive family relationships seem to contribute to successful reentry, and also that there are interventions that appear to strengthen family relationships. Now, those interventions had never been tested in the context of work with families where one of the partners is incarcerated. So using part of the 150 million, just a small part of that 150 million, HHS published a grant solicitation that encouraged applicants to submit proposals to do marriage and family strengthening programs for incarcerated fathers and their partners in prisons. And we also contracted for an evaluation of those programs to see if they actually strengthen family relationships and contribute to more successful outcomes post-release. We don't have finding yet of the impact of this evaluation. Those will be coming out in the next couple of years. But we've learned an awful lot about the complications of doing family interventions in the context of a prison environment. And I want to just mention what those are, but first I want to just very, very briefly talk about what the intervention is. And so the intervention in a family strengthening program is to